Hi there, this is Tracy from Lucere Downtown. I'm here with the lovely Ray, and we are going to give some definition, a little pop of hydration, and some volume and structure to her beautiful lips. And then we're going to finish off with her cheeks. We're going to give her a little bit of a lift and some nice contour. So let's get started. We've been numbing Ray with a topical numbing cream for about 15 minutes, which is going to help make the procedure quite nice and comfortable. There is numbing in the filler, which is going to also numb the lips once we start the procedure. And then a couple props for her is a squeezy ball and a little vibration tool just to distract her brain. So we're just gonna deposit some product and get that numbing going, okay? So I kind of go all the way around. I want to get the lidocaine in here activated kind of everywhere. So I kind of just circle the lips and then I go back and I refine things. Post-care will be just avoiding anything that thins her blood for a couple of days, like aspirin and ibuprofen. Omegas, they tend to thin the blood, and it can create a bruise if the blood is too thin. And then we'll also keep her kind of sedentary for the rest of the day, so no exercise, just to prevent the heart rate and blood pressure from getting up, potentially creating a bruise. But other than that, she'll be fine. We'll give her some ice when we're all done and she'll be good to go. It takes about 2 to 3 weeks for healing. Filler always looks good the day of treatment, but it does need time to settle and integrate into our tissue. And I like to give that, about 2 weeks and then bring her back for a follow-up, just to make sure everything looks great and everything is balanced nicely. So we're going to add a little bit of arnica gel to the lips. Again, this is really nice for healing. It helps minimize bruising, it helps minimize the swelling. And then on top of that, I put a little layer of Vaseline, just the cleansing agent, the stanhexidine, is a little bit drying to the lips, so it's nice to moisten them up with a little Vaseline as well at the end. All right, so we just finished Ray's lips, and she's gonna take a peek.
Oh, I love them. They're perfect.
You're welcome.
So the distraction tools, the numbing cream, and Tracy's technique make the treatment really, really comfortable. I feel a few little pokes here and there, but otherwise super comfortable.
So next we're going to move on to the cheeks. So we're going to put a little bit of filler in her cheeks to give her some contour. Takes the weight off of the mid-cheek there and just brings everything up nicely. So here she's getting a nice little curve. Here she's flat. So we're starting to create a little bit of a pop in that cheek. We're not done yet. More to come. Okay, so now we're gonna do a little bit of a top model cheek with a cannula. So phase 1 was with the needle, and phase 2, a little cannula work. With one poke, we make a little entry point. We fish the cannula into the tissue and we deposit the product that way. So as the healing occurs, everything will settle nicely and integrate into her tissues. It'll just look better with time. So typically in 2 weeks it'll look a bit better, and in 4 weeks it'll be fully healed and it'll look amazing. Takes on the nice curvature of her cheekbone, integrates into her tissue, and just gives her a beautiful, soft, natural look. So now you can see clearly she's lifted on this side compared to her other side. She's got a really nice soft lift. But again, the arnica gel is really nice for swelling and bruising, helps with healing. Sometimes we'll swell more on one side than the other. So I say just trust the process, give it time to heal and settle. And when we see you at your 2-week follow-up, if there's any balancing that needs to be done, we'll do it then. But everything looks beautiful.
To be honest, on the cheeks, I didn't even feel it. Tracy, I think we can all agree Tracy is amazing at what she does, and I'm so excited to see the final result.